Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant and health educator and hospitalist. I'm here with some outstanding respiratory therapists. This is the last day of respiratory therapy week. So happy respiratory therapy week. So I wanted to ask these wonderful ladies very quickly about what is a respiratory therapist?
So respiratory therapists, we are the anchor for critical care and cardiopulmonary. We take care of the ventilators, CPAP, BiPAPs, nebulizers, both for NICU and PEDS. We also take care of intubated patients and trach patients. We do trach cares, and we also assess patients that are respiratory distressed or needed assistance when they are non-responsive. We are always at the bedside or at the headboard of any CPR or code.
Yes. I rely on these guys as a hospitalist PA. We rely on the respiratory therapists very heavily because we have a lot of patients with respiratory failure.
Yes.
Especially now in the state of COVID-19, you hear a lot of talk about we need more mechanical ventilators. So this is a mechanical ventilator. Yeah. So what do we do with this?
So this is mechanical ventilators. Why it's called mechanical ventilator means that it actually mechanically helps patients that cannot breathe spontaneously by themselves. So we use this to support them, to help them recruit themselves while they are critically ill. So when they cannot breathe on their own, we have settings on the mechanical ventilators that comes with the mode, which is tidal volume, PEEP, respiratory, set respiratory rate, and also FiO2, which is oxygen level, because those are the things that every human being needs in order for them to breathe and stay alive. So when you set all that on mechanical ventilators and you now put it on a patient that is unresponsive or who cannot manually ventilate themselves, this mechanical ventilator helps them to breathe, support them until they get better from their critical illness.
And the tubes, we see a lot of tubes here, so a lot of times a person's got to be intubated, right?
Yes, you have to intubate them in order for you can actually do non-invasive, but if the patient is not spontaneously breathing, you definitely have to intubate them or trach them if they have a difficult airway when it comes to tubing them. So you will use this.
So intubation, the tube will go in
Through the mouth or through the nose.
Okay.
Depending
Or through
on
the nose.
Yes.
So then if they cannot be able to be weaned, so that's when they trach them. So in traching them, so we also help them to put them on spontaneous breathing. Then that's where aerosolized trachea comes in. So we are weaning them off from the ventilator in order for them to be able to breathe on their own.
And what is the trach?
The
tracheostomy is when you actually bypass the facial mouth, nose to go under your trach to get a patient to breathe. I'll show you what a tracheostomy patient looks like. This is a trached patient. So this is where you trach the patient and get them a means to breathe.
So there's a tube that
This is
actually
actually an intubated patient too.
So here.
When you get a patient intubated
So the tube goes,
through the mouth or through the nose.
and here with the tracheostomy, the doctor will actually cut a hole in between the cartilage here. So the cricoid cartilage, we have thyroid cartilage and cricoid cartilage. So a hole's cut in there, and this hard plastic tube's put in there, and then they're hooked up
Into the ventilator.
into the ventilator.
That breathes for them.
Yeah, and then sometimes this is a what is this here?
The cover to the ambu bag that we use in order to pre-oxygenate them before they were intubated.
Then you can
And this is
connect
the
that.
lung.
This is called the lungs.
Okay,
Okay.
and then the how does this go?
That's an ambu bag.
That's an
Okay.
ambu bag that goes into the patient's face, oxygenate them before they get intubated.
Okay. And so you have to know a lot. What are some of the classes that you all had to take?
Actually, it's the same program just like nurses.
nurses?
It takes us 2 years to get an associate degree in respiratory care. And we
And
basically do the same prerequisites like nurses.
Okay.
Then we split after you get your anatomy, your chemistry, your physics, your math, and English, the whole 9 yards. Then you can now switch to do the respiratory 18 months.
And you took anatomy?
Yeah,
If it's-
we
We
both
do all the prerequisites for
Yeah.
to
nurses.
chemistry,
Anatomy
biology,
1 and 2,
anatomy 1 and 2,
microbiology.
microbiology,
Math,
so
English.
math, English.
Yeah.
So, yeah.
So that's a lot. It's a very challenging course, program. And the pulmonary, some pulmonary.
Yeah, that is
Yeah.
when you get into the main program, you start doing the cardiopulmonary.
Acid-based,
Acid-based,
mechanical
ventilation,
ventilator,
yes.
neonatal, and all sorts.
Okay,
Yeah.
all right. So it's a great job. There's only about 100, I saw in the Bureau of Labor and Statistics, there's only about 140,000.
Yes, currently as respiratory
And I
therapist.
mean, that's a very small number in
Yes.
proportion to our population. So we need a lot more. For those of you guys that are interested in it, I'll put the link to the American Academy of Respiratory Therapists
Okay.
in the description. But thank you, ladies, so much. These guys are great. I cannot do what I do without them. But
Wow.
God bless you all.
God bless you
If you're interested in it, please check out my channel. Take care. Peace.
Thank you.
too. Thank you.
Thank you, ladies.